The plastic bins clatter at security. Your phone still buzzes. Somewhere upstairs, in a federal courthouse in San Francisco, a case caption waits with your name on it. And in pediatric offices across America, one sentence already means something different. On January the 5th, 2026, the CDC strips universal recommendation status from 7 childhood vaccines: rotavirus, meningococcal disease, hepatitis A, hepatitis B, influenza, COVID-19, and RSV. A clean answer, yes, your child should get this, suddenly turns into high risk only, or shared clinical decision-making. It sounds technical. It isn't. You are Rob Bonta, Attorney General of California, and you know what happens when public health starts speaking in softer verbs. Parents hesitate, doctors hedge, insurers ask questions, state agencies scramble. And if this hardens before the next vaccination cycle, before the next flu season, before the next RSV wave, confusion becomes behavior. Behavior becomes exposure. That is why you are here. Not months from now, after the drop in uptake shows up in case counts. Now, before a memo becomes a norm. The fight begins a month earlier, on December 5, 2025, when the White House orders HHS and CDC to compare America's childhood vaccine schedule with 20 peer-developed countries and align the US with superior approaches abroad if they exist. Soon the comparison settles on countries like Denmark, Japan, and Germany. The message is politically perfect. America gives too many shots. Then the federal government moves fast. CDC says Acting Director Jim O'Neill signs a decision memorandum on January the 5th after a comprehensive scientific assessment. HHS says the goal is to rebuild trust, strengthen informed consent, and create a leaner schedule. America, they argue, was an outlier, about 17 to 18 diseases universally recommended for children, now cut to 11. But standing where you stand, reading the language line by line, you see the real downgrade, not just in coverage categories, in confidence, shared clinical decision-making. You can almost hear it land. A pediatrician pauses. A parent leans back in the chair and asks, "So, does my kid still need it or not?" And that pause is the danger, because once the federal recommendation weakens, the consequences do not stay on a CDC webpage. They spread into school guidance, into Medicaid planning, into the Vaccines for Children program, into the exam room. That is what makes this more than a policy dispute. This is a fight over who gets to rewrite public health reality. By the time this memo lands, the machinery behind vaccine guidance has already been shaken. According to your complaint, all 17 voting members of ACIP, the CDC's Advisory Committee on Immunization Practices, had been dismissed in 2025. California alleges at least 9 of the 13 replacement members lacked the qualifications required by the committee's charter. Worse, your filing says NIH Director Jayanta Bhattacharya, CMS Administrator Mehmet Oz, and FDA Commissioner Martin Makary, officials with no ordinary CDC vaccine policy role, pushed the January 5th recommendation to O'Neill. That detail is everything. Because your argument is not just that the answer is wrong. It is that the process meant to make the answer trustworthy was broken. You put it bluntly. Public health decisions must remain grounded in truth and facts. That's why, for the 59th time, I'm taking the Trump administration to court. The phrase is sharp, but the numbers behind it are sharper. For children born in the United States from 1994 to 2083, routine childhood vaccination prevented an estimated 508 million illnesses, 32 million hospitalizations, and more than 1.1 million deaths. It saved about $540 billion in direct costs and $2.7 trillion for society. That is what a trusted recommendation system does. Now imagine what happens when that system starts blinking maybe. Imagine the hepatitis B birth dose being weakened after decades of universal use, even though California says the shot is up to 90% effective at preventing perinatal infection when given within 24 hours of birth. Imagine RSV getting pushed toward a high-risk framework when doctors warn that many hospitalized children were healthy before they got sick. As the San Francisco Chronicle summarized Stanford expert Yvonne Maldonado's warning, if you rely on a risk-based RSV strategy, you're going to miss 80% of the kids. This is the nightmare at the center of the case. Not that every vaccine vanishes overnight. The administration insists vaccines remain available and that many coverage protections still exist. The nightmare is subtler. The signal weakens. The parent waits. The appointment gets postponed. The season turns. If you're enjoying this story, hit subscribe so you don't miss what happens next. Because the deeper you go into the paperwork, the stranger it gets. California's complaint says the January 5th memo was even misdated, signed on January 5th, 2026, but dated January 5th, 2025. Maybe clerical sloppiness. Maybe haste. Either way, it is the kind of tiny bureaucratic crack that feels enormous when the decision touches millions of children. And the legal stakes reach far beyond one memo. ACIP recommendations are woven into federal law. Under the Affordable Care Act, no-cost preventive coverage is tied to them. The Vaccines for Children program, which your complaint says supplies more than half of all children's vaccines in the United States, depends on them too. Medicaid systems rely on that architecture, so when Washington changes a recommendation, it is not just changing a sentence on paper. It is tugging on the wiring behind insurance, access, and state obligations. You can't wait to see if that confusion settles on its own. You know how outbreaks work. They start small. Your complaint points to one scene from Pennsylvania in 2025. A single unvaccinated child brings measles into a childcare center. Then the phones start ringing. More than 200 contacts. Follow-up calls. Immunization records checked. Post-exposure prophylaxis arranged. Families disrupted. Childcare interrupted. One child, one exposure, 200 consequences. That is what you are trying to stop before it scales. California is not waiting. At home, the state has already built a firewall. AB 144, signed in September 2025, requires California health plans to cover preventive services recommended by the federal government as of January 1, 2025, or by the California Department of Public Health, without cost-sharing or prior authorization. Even as the CDC changes its message, California tells parents and providers, our guidance has not changed. But the country around you is fragmenting. By January 20, 2026, KFF finds that 25 states are relying on non-federal sources for all routine childhood vaccine recommendations, up from 9 states just months earlier. America no longer has one vaccine map. It has competing maps, a federal map, a state map, an AAP map, a West Coast map. That fragmentation is not a side effect. It is the emergency. So on February 24, 2026, California co-leads a 15-plaintiff coalition, 14 attorneys general and Pennsylvania Governor Josh Shapiro, and files suit in the Northern District of California. Your claim is direct. The administration bypassed expert process, unlawfully remade the advisory committee, ignored reliance interests, and pushed a reckless, unscientific childhood vaccine schedule that puts kids at risk. Outside court, you say it even more clearly. The Trump administration's attacks on science are irresponsible and dangerous. Undermining confidence in vaccines will lead to lower vaccination rates and more infectious disease. And then the institutional resistance widens. The American Academy of Pediatrics and other medical groups sue too. Their president, Andrew D. Racine, says children's health depends on vaccine recommendations based on rigorous, transparent science. Massachusetts preserves an evidence-based schedule. New York does too. This is no longer one state versus one administration. It is a fight over whether expertise still has a process. Then, on March 16, 2026, the first big break, a federal judge temporarily blocks the administration from cutting the number of vaccines recommended for all children and says Kennedy likely violated procedures in remaking ACP. Temporary, not final, but real. For a moment, the motion stops. And maybe that is the heart of this whole story. You are not trying to prove that law is more important than science. You are trying to use law to defend the process that keeps science from becoming a slogan. Because if a childhood vaccine schedule can be rewritten by memo, by comparison chart, by officials outside the normal chain, Then public health stops being a system of evidence and starts becoming a contest of power. And in public health, confusion is not neutral. It shows up later, in waiting rooms, in ERs, in county phone logs, in parents who thought maybe meant safe to skip. That is the battle Rob Bonta walks into. Not just over 7 vaccines, but over whether truth in medicine can still survive politics long enough to protect a child. If you enjoyed this, please like, share it with your friends, and subscribe.